Hello, my name is Heather Yu, and today I will be presenting my case study on superbugs, specifically Shigella in the United States, for my Global Health Disaster Preparedness and Response class. A brief overview of the presentation today. We will briefly discuss the case and information regarding infection. Then we will move on to the facts of the case, the person, places, and times affected by the infection. Then we will move on to the epidemiological aspects, study methods, analytical approaches, and biases associated with the infection case, and then management associated with how this specific case study was managed by the public and the government. Finally, we will move on to communication, public communication surrounding the event, and a summary, which is the takeaway message and the importance of this case study. The introduction will cover what is antibiotic resistance and what is Shigella. Antibiotic resistance has grown in public health threat as previously known treatment methods become ineffective in handling common infections. Leading public health officials fear the end of antibiotics as many strains of bacteria continue to become resistant to last-line defenses. Shigella, a common gastrointestinal bacterial infection with around 100 million infections annually, has become increasingly resistant to antibiotics since 2013. Of those 100 million annual infections, 450,000 are in the US, and 17% of these infections are drug resistant. Introducing the facts of the case, from May to February of 2014 to 2015, multi-drug resistant or MDR Shigella swept through 32 states in the United States, dominating large areas of Massachusetts, Pennsylvania, and California. Around 245 people were infected, and 20% of these cases resulted in hospitalizations. This specific strain was concerning as it was part of only 6% of strains resistant to the most common treatment method, ciprofloxacin. Like many drug-resistant infections, those with weakened immune systems are highly susceptible to infection. Shigella, however, also disproportionately affects children, international travelers, and men who have sex with men due to its reservoir in the colon and intestines. The 2014 to 2015 outbreak was linked to travelers visiting Morocco, India, and the Dominican Republic. However, many of the infected people had not traveled outside of the U.S., indicating the strain's circulation within the country's borders. Luckily, many patients were able to be treated given the U.S.'s extensive healthcare system. However, globally, MDR Shigella kills around 600,000 people annually. This outbreak demonstrates the overall threat to global drug resistance, even on first-world countries like the U.S. Additionally, the growing danger of drug-resistant infections continues to take an economic toll on the U.S. as well, with an estimated annual health care cost of at least $4.6 billion, 93 million of which goes directly to drug-resistant Shigella. The specific MDR Shigella outbreak of 2014 to 2015 was determined through hospitalization records of infection and testing, making it a retrospective cohort study. Patient records were used to determine their infection status, and causality was determined through contact tracing and questionnaires. Analytically, the outbreak was described by leading epidemiologist on the study, Anna Bowen, who detailed the long-term threat of MDR infections on the medical field should they continue to advance. Potential sources of bias in the outbreak report lie in the publisher, as it is reported in an NPR article rather than a scientific journal. While NPR is regarded as neutral and biased, it is expected that any source of media may hold bias to benefit their appeal to the public. The author tries to mitigate this bias by quoting Bowen throughout the article and citing trusted governmental agencies like the CDC for validity. Additionally, limitations in the study involve the nature of the subject, as antibiotic resistance is generally considered a taboo subject in the medical field. Hospitals tend to underreport infection rates, not wanting to cause public panic or be seen as infection zones. The specific treatment methods and management of the 2014-2015 outbreak are not described in the article. However, it is noted that typical Shigella infections subside independently after 1 week. In cases of drug-resistant Shigella, alternative antibiotics are utilized to fight the infection, moving from all known oral treatments to IV treatments as a last resort. The U.S. as a whole has taken action in managing the global crisis of antibiotic resistance by strengthening detection methods in hospitals, improved restrictions and uses of antibiotics, and prioritization of research for new treatment methods and alternative treatments. Additionally, the creation of the Transatlantic Task Force on Antimicrobial Resistance, or TATFAR, has been a global effort to address the threat and limit future casualties. The article describes the intricacies of the outbreak and also quotes directly from the head of the study. Further research on this topic results in more notable news and media sources discussing the threat and implications of the outbreak during that time. Overall, from a media standpoint, the coverage of the event was sufficient as different sources openly discussed the facts with the public. As mentioned previously, it is expected that there are some limitations in the data reporting itself from the hospitals. However, that did not fall within this specific communication of the event. Dr. Bowen was open with the interviewers and stressed the facts of the case while also describing the implications and methods of prevention that are needed for addressing similar infections in the future. This openness with the media and public is imperative to preventing further cases as it brings attention to the issue while also promoting methods of prevention education. From a national standpoint, the U.S. is doing an adequate job at communicating the threat of MDR infections to the public with the annual publications of the Antibiotic Resistance Threats Report. However, more can be done to bring information to the more general public. The infection and spread of the multi-drug-resistant Shigella strain around the U.S. in 2014 to 2015 indicates the dangers of MDR infections on a global scale. To combat similar outbreaks in the future, it is crucial that we, as a global power, dedicate proper resources to research and prevention methods internationally to antimicrobial resistant infections. Finally, communication and education on the dangers of these infections must improve if the public health community aims to stop these threats in the future. Thank you. This is the end of my presentation.